It often takes an acute or immediate stressful or disastrous event to reveal hidden cracks and flaws in the foundation of structures and institutions. In light of recent events in Minnesota and the global outrage and protest that those events have sparked, combined with our ongoing struggle with the COVID-19 pandemic, it should be clear to most that racism and bias are foundational elements with respect to equity, justice, and healthcare disparity. In response to what these events have shown us, the PAFP issued a statement on racism, discrimination, and health in all policies, expressing our deep concern regarding the impact of discrimination, racism, and the resultant dehumanization, marginalization, and preventable deaths of people of color. We consider racism to be a public health crisis, and we stand against all forms of racism, discrimination, and bias in our institutions, communities, and societies. We acknowledge that though the COVID-19 pandemic has shined a light on health disparities across our Commonwealth, these issues have existed within Pennsylvania communities and nationwide for decades. There can be no dispute the elimination of health disparities will not be achieved without first acknowledging racism's contribution to health disparities and social inequality. The PAFP was recently awarded grant funding from the AAFP Center for Diversity and Health Equity to provide implicit bias training to its members through a campaign that promotes education, practice, feedback, reflection, and change. We continue to contend that the work of the family physician is uniquely intertwined with the communities we serve, and we need to ensure that all patients and their families feel like valued, equal members of society. We applaud the Pennsylvania General Assembly and Governor Tom Wolf, whom last month passed and signed a partial stopgap budget for the 2020-21 fiscal year. The budget will provide 5 months of flat funding for most state agencies and operations through November 30th, with the plan that legislature will return to Harrisburg in the fall to pass a spending plan for the final 7 months of the fiscal year. Despite the COVID-19 impact on the state's finances, the PAFP's residency expansion program will remain fully funded through November 30th. Recruiting and retaining primary care providers is essential to providing high-quality, cost-effective health care to all Pennsylvanians. At no time has this been more evident than during the coronavirus crisis. Pennsylvania's family medicine residents have been on the front lines of the COVID-19 pandemic, working alongside other physicians in emergency departments, inpatient and ICU units, mobile testing tents, community outpatient clinics, and street side, treating the state's sickest and most vulnerable populations, providing routine care to patients of all ages, and maintaining continuity of care for those suffering from chronic illnesses. The PAFP staff will continue to advocate for funding for this important initiative. Even in the midst of a global pandemic and in the context of physical barriers to in-person gatherings, we recognize that our profession is one characterized by lifelong learning. To that end, the PAFP has forged ahead, providing quality online CME to our members and physicians across the state and country. Our Adventures in Family Medicine conference, scheduled for September of this year, has been postponed until June, and we encourage you to stay tuned for more information. And unfortunately, the Alaskan cruise, scheduled for 2021, has also been postponed until further notice. We do plan to move ahead with holding our November CME conference with in-person and virtual options, and we're excited to partner with the University of Pittsburgh Medical Center on what is sure to be another outstanding program. As we continue to press onward through this troubling, trying, and traumatic season, we do so with diligence, determination, and hope. We thank you for your ongoing tireless work and consistent support as we work to represent your interests and to continue to make sure that your work is recognized and your voices are heard.